Hello and welcome to this podcast series from Manipal Academy of Higher Education. I am your host, Kumaran P. Today, we are talking about health sciences at Manipal. When we hear that phrase, many of us immediately think of hospitals and patient care. But at MAHE, health sciences and services are also classrooms, spaces where students learn not just medicine, but responsibility, empathy, and leadership. As someone who closely follows healthcare and education in India, I truly believe that institutions which combine service with learning play a critical role in shaping the future of healthcare, especially at a time when systems across the world are under immense pressure. Joining me today is Lieutenant General Dr D Venkatesh, Vice-Chancellor of Manipal Academy of Higher Education, a distinguished ENT surgeon, medical educationist, and former Dean of the Armed Forces Medical College, Pune. He brings nearly 4 decades of experience across clinical care, education, administration, and national health policy. Doctor, thank you so much for joining us today.
Thank you very much. Amazing talking to you.
Thank you. In what aspect or personally you define health services at MAHE?
So this journey began close to 7.5 decades ago, 73 years ago, or even earlier, when our founder, late Dr T.M.A, decided that he will build something for the future, something for his own community, something for the country and beyond. So based on this, the healthcare delivery system or health sciences at MAHE is not defined by one particular institution. It is defined by the ethos of the organization itself. It all began in 1953 when our founder decided to start a medical college in this remote area, one of its kind. It's a public-private partnership with the then government of Madras and Manipal Academy of Higher Education. That a small beginning happened here at Manipal. This has now grown into a global institution where the ethos does not begin by inculcating, it is internalized. It is in the thought process. It is what we breathe. That has come up from a community requirement to the current stage of a global requirement. So this is something which is very, very unique. And I want to distinguish between medical services and health services. So today, it is not a doctor-driven health services. It is a team-driven healthcare services. That means the pandemic and earlier also has shown us that the doctor-driven healthcare services often misses out on the few other aspects. Today, a healthcare team does not necessarily have a doctor who obviously leads the team, but it has nurses, it has paramedical staff, it has got allied health professionals, it has got pharmacy professionals, and various other sub-entities, including technology people. Therefore, it's a very, very comprehensive healthcare solution provider that one needs to look at in that fashion. It does not begin and end at hospital. In fact, it begins at the primary healthcare level. And then it scales up to a quaternary services that is offered at our Kasturba Medical College. Therefore, this is a bottoms-up approach that has worked very well as far as healthcare services are concerned in this part of the country. At Manipal, we have built it brick by brick. It did not begin with a hospital. It began in the villages, in the periphery. And then gradually we've built up and scaled it up to current levels. To be ranked amongst the best medical schools, best nursing schools, best allied health schools, best pharmacy schools, not only within the country but across the globe, is not an easy task. It's a far-reaching, predetermined pathway that we have chosen for ourselves to equip and move in that direction. Today I'm very, very happy to see that the healthcare services and healthcare education that is offered by MAHE through its institutions and through its hospital services spreading across more than 4,500 university-owned and run hospital beds provides the most comprehensive healthcare delivery system and a most comprehensive, globally recognized medical, dental, nursing, allied health education in this country.
Thank you, sir. So, we've actually come from grassroots and an institution that's grown to a global level and globally acclaimed institution. At MAHE, when it comes to patient care, when it comes to medical education, how do you strengthen this?
It's a very good question, actually. Medical education Without a hospital is no education.
Correct.
And medical education without a quality faculty is not a good medical education. And more than anything else, the resources that are required to give a world-class medical education takes a lot of planning, a lot of investment, and a lot of efforts.
Yeah.
And to consistently give the same quality of medical education, including clinical training, and to make the doctors of the future who are not only competent in knowledge, skills, but also in attitude. In terms of medical education, we always speak of three domains: domain of knowledge, domain of skills, and the domain of affective domain, which is the domain of empathy, sympathy, good communication skill, and understanding the emotional needs of the patient and being able to address them in a very holistic and a comprehensive manner. Therefore, a good doctor always is empowered or taught to have great knowledge, great skills. This is where there has to be a very, very holistic combination of all three skills. To provide this, you require great infrastructure. To provide this, you require quality faculty. You require role models. You require well-equipped classrooms, laboratories, world-class hospital services, and more than anything else, the people who run this. It's not about only the doctors and the nurses, but also the support staff and the integration of technology into everything that we do. Therefore, it's a one huge package which has got multiple components, and a very, very logical and holistic integration of all these things defines global quality medical education.
Right.
I'm very happy that this has been happening in MAHE over decades. And today we are ranked amongst the best medical institutions, not only within the country, but also outside.
So, from your experiences in the Armed Forces Medical Services, what leadership lessons are most relevant to the healthcare industry nowadays?
I think it's about understanding the needs of the community, the people, being aware of the regulations and being aware of the resources that are required. That means planning, execution, audit, evaluation, and course correction. These are the 5-6 very important lessons in any field, for that matter. Why only in medical education or medicine? In the armed forces, you're not only a healthcare professional as a doctor, but you're also a soldier, and you're always a leader. You have to lead from the front. So this attitudinal shift is required when you come from armed forces milieu into civilian milieu.
Right.
It requires a lot of unlearning, it requires a lot of relearning, but yet you do not change the core values. I'm very, very happy to state that the core values of Manipal and the core values of armed forces are absolutely complementary. They reflect each other's.
That's great.
Therefore, this is something I did not have to try too much. And of course, I had to bring in some of the positive lessons that I learned my long 38 years of service in the armed forces, to bring in that best practices that we do in the armed forces, blend it with the best practices that we do at Manipal. And the recipe was really, really very good.
Very good.
And the progress that we have made over the last 5.5 years as a Vice-Chancellor here, not only in the healthcare education, but also in all the other domains of education, has been extremely satisfactory.
So then how are values like ethics, discipline, and accountability woven into medical services, medical delivery at the MAHE?
As far as the healthcare delivery system is concerned, ethical practice is critical. Human values are very critical.
True.
Judgment is very critical. Your skill sets, both in knowledge, skills, and attitude, are very, very critical. And often many of them are not taught in the classroom. They are imbibed by the work environment that you are in. Therefore, it's the ecosystem of MAHE helps you to develop these attitudes of honesty, of integrity, of human values, of teamwork, of being with people, working with people, building teams, working for the team, working with the team. Therefore, these are very, very critical to success, not necessarily as an individual, but also as an organization. Therefore, a lot of it depends on the foundation on which you are building. And we always see that, we look taller when we stand on the shoulders of our predecessors. This is true in MAHE too. A lot of work has happened before me. It will continue to happen after me. But the the essence of the matter is we are all moving towards with a single-minded objective of making the best things available for the people whom we serve.
That's great.
As for the stakeholders, firstly in healthcare delivery system, the patients. Stakeholders for us in the education sphere is our students, the parents, the employers, and the country as a whole, and an ecosystem which is today a boundaryless ecosystem. What happens in India reflects very easily in the other parts of the world and vice versa. Therefore, you need to be globally aware, globally relevant, and you need to inculcate the best practices which are accepted across the globe. So at MAHE, we believe in preparing students as a global citizen who will be able to excel in his chosen field anywhere in the world and continue to serve the community which he chooses to serve.
Great, sir. When you say we are preparing students to be the global leaders, now innovation is a very big focus. How is MAHE embracing technology and indigenous solutions, for example, in the healthcare industry?
Yeah, I think I can say with a great pride that MAHE as a university is always ahead of its time. That means we anticipate change. We do not adapt to change.
Great.
We bring in transformation. We don't follow the others. Therefore, anything that is happening, the best practices across the world is already also adapted and taken forward.
Right.
I'm giving you a very simple example in terms of technological advancements, especially in training for healthcare professionals. A lot of technology is involved. A lot of resources, a lot of library resources. We have some of the best libraries in the world, digitally available to our students and faculty. Literally every publication in the world is available on the student/faculty's email ID. We invest a lot on digital technology, digital transformation. In fact, the MAHE is moving towards becoming one of the digitally transformed university in the very near future. The work began with incorporating AI in every aspect of our activity, from teaching, learning to administration, not necessarily only descriptive AI, but we are talking about generative AI and agentic AI as we move forward. So the big focus is always looking at the latest developments and bringing them at MAHE so that our faculty, our students are already trained on it when they go and face the real world challenges outside. And as far as the innovation ecosystem is concerned, currently the MAHE has a 360 degrees innovation ecosystem, from ideation to innovation to entrepreneurial journey to IPR production to device development to technology incubators, and there is a very big push towards multidisciplinary education. And AI is fully incorporated in our education system. It's not about only learning, but you look at the ecosystem and the campus life that MAHE provides to its students. So a student who studies in a multidisciplinary ecosystem is better prepared to understand and appreciate the requirements of real world problems. So in that end, I think it's a wonderful place for any student to come and learn. And we bring them as raw diamonds, and by the time they leave, they are fully polished diamonds.
Oh, that's a great sentence. Thank you, sir. Thank you so much, sir, for joining us in this conversation.
Thank you very much.
Thank you. It's clear that at MAHE, it's not just about treating patients, it's about creating world-class healthcare professionals. Thank you, listeners, for joining in. This is Kumaran signing off.